coming tonight, ladies and gentlemen. My name's Chris Branscombe. I'm the Chief Executive Officer of Eastern Pennsylvania Youth Soccer. And we're really proud to put on this event tonight, the Concussions, Children and Concussions in Sports Symposium. We have some excellent presenters this evening. We at Eastern Pennsylvania Youth Soccer knew that in our sport, it was very important to look at concussions as well as any other injury in youth sports. And we knew that there just wasn't enough good information, or perhaps there was too much information, and we weren't sure which way to go. In 2011, of course, the Safety and Youth Sports Act was signed by Governor Corbett. That gave us some direction. In our world of youth sports, outside of scholastic sports, we're not entirely covered by that law. However, it was a great base for us, and we, with our board of directors, adopted that law for part of our own policy. So we've been on this course for the last couple of years on how to deal with concussions. It's become obviously a very important discussion in the mainstream media. It's always been something we've talked about in sport. But again, there's so much information that we're not sure what is the good information, what's the bad information, and how should we sift through it. So we decided tonight to put this event on to bring together some of the most experienced people that we could find. We have professional athletes, youth athletes, people from the medical profession, and we have some guests from the world of coaching that are going to help us understand the things that are happening and the things that we should be paying attention to try to gauge how concussions are affecting our children. And for those of you in the soccer world that hear me speak, I generally stay away from calling them athletes or our players, because make no mistake about it, they're children. You know, in Eastern Pennsylvania, we deal with 130,000 children from ages 4 to 19. And it's our job to protect them and to give information to their parents and their coaches to keep them playing safe for many, many years, well beyond their playing days. So with that, I'm pleased to welcome you all tonight and to welcome to the stage the co-sponsor of the Safety and Youth Sports Act, Senator Pat Brown.
Thank you for the opportunity for me to provide some opening remarks to this very important symposium, and to congratulate the Eastern Pennsylvania Youth Soccer Association, Chris, the board of directors, the officers, the coaches, volunteers, for taking a proactive role on looking for greater means to provide for safety in youth sports and to raise public awareness of the dangers of concussive injuries that continue to occur in youth sports. From a personal perspective, I come from a large family, 7 brothers and sisters. All of us were in competitive youth sports. Many of us played soccer, but most specifically, my younger brother was the varsity goalie at Muhlenberg College and played professional indoor soccer in Harrisburg and Denver. And unfortunately, his career was cut short because of many concussions that he experienced and had as a result of playing goalie in both the college level and the pro level because of the dizziness and the continuous headaches that he had as a result of that. And I mention that from a perspective of personal experience, but also from a perspective of the advancement in understanding, because it was not that long ago when my brothers and sisters and I were in youth athletics, and now when these types of injuries were downplayed and totally misunderstood. It was all too common just to say that a player simply got his bell rung after a violent collision. Often these players were told just to shake it off and get back on the field, as you know. Certainly and justifiably, there is now a heightened public awareness of the dramatic occurrence and consequences of head trauma resulting from sports competition. We now know that severe and repeated concussive injuries dramatically impact the brain and too many former players are paying a heavy price for those injuries. In some cases, athletic careers, as you know, and even their lives, were cut short by the intensity and cumulative impact of those injuries. The media's attention to the danger of concussive injuries among professional athletes has also carried down to the collegiate, scholastic, and younger levels as well, and justifiably so. Studies indicate that concussions account for 15% of sports injuries among young adults, and for those 16 through 24, sports are second only to motor vehicle accidents as the causes of brain injury. Studies also show that when a student athlete suffers a concussion, as many as 40% return to action prematurely and set themselves up for serious injury in the future. As you probably know, concussions are especially common and suffered by soccer players as well. In fact, studies have shown that soccer has the highest rate of concussions among all scholastic girls' sports, even over gymnastics, basketball, and field hockey. And the rates are increasing among all sports. Perhaps it is just we are all finally recognizing the seriousness of these injuries. Unfortunately, when you add the prevailing attitudes of our driven, outstanding youth athletes, especially those involved in competitive sports, it can turn into a recipe for disaster. By their very nature, like we all were, and many of us continue to be, many scholastic athletes must almost be dragged off the playing field, regardless of their injury. That's where it is up to the whole team, athletes, coaches, trainers, parents, volunteers, to step to the forefront, be proactive, and act accordingly. Up to a year ago, as you know, there was no standard nor any requirement in Pennsylvania for that preventative action to take place in the case of a concussion. And in the heat of the battle, above all else, and I'm sure everyone in this room agrees, we must continue to place the welfare of our student athletes as our #1 priority. For this crucial reason, on November 9th, 2011, Governor Corbett signed into law the Safety in Youth Sports Act, a measure I introduced to increase awareness and prevention of traumatic brain injuries among Pennsylvania scholastic athletes. Under Act 101 of 2011, students showing symptoms of a concussion must now be sidelined by officials, coaches, athletic trainers, licensed physicians, or other officials designated by the school, and barred from participating in games, competitions, scrimmages, or practices until evaluated and medically cleared by an appropriate medical professional. This law requires common sense steps and precautions be taken after a student athlete sustains a suspected concussive injury. Due to Act 101, Pennsylvania law now requires the state to take a proactive role in addressing concussive injuries as well. The Department of Health and the Department of Education must post information regarding head injuries and concussions on their websites, and young people and their parents are required to review information regarding the risks of these injuries before a student may participate in scholastic sports activities. In addition, this new law mandates coaches, as you know, be trained yearly in a program certified by the CDC, the National Federation of High School Athletic Associations, or other approved programs regarding the risk of brain injury in scholastic sports. They must be fully aware of the warning signs of these injuries and know what to do when they take place. And as Chris said, although this new standard only legally applies to athletic events sponsored through the Commonwealth's many fine primary and secondary education institutions, it should act as a foundation for the implementation, if they don't already exist, and I know that you've accepted the act as a framework for these types of protocols in your youth sports, for similar safety plans and procedures for all competitive youth sports in Pennsylvania. Ladies and gentlemen, I know you all agree that there is no reason whatsoever for a young person to put their life and future in jeopardy if they choose to compete in youth athletics. There is no scholastic trophy, no championship, no title worth a traumatic injury. The health and well-being of our children, as Chris said, our young athletes, must never be compromised by the heat of competition. On behalf of the Pennsylvania Senate, I'm pleased to stand with all of you who are encouraging all of our young people to be physically active and participate in competitive sports. but competitive sports which promote and ensure, through the collective commitment of all those involved, the protection and safety of our one-of-a-kind young people and student athletes. Thank you, and congratulations on your symposium.
Now it's my honor to turn the microphone over to somebody who's better at speaking than I am. Legendary broadcaster from the area, Mr. Don Tollison.
I think those of us who believe in youth sports and its importance often look at things like Title IX. And laws can't automatically change minds, but I often think of where this country would be if the opportunities for young women and older women athletes, once they got to the college divisions, if they had not gotten the legislation passed, and a lot of people don't know this, but one of my civil rights heroes, because that was a civil rights development to give women and girls equal opportunity in sports to boys and men. A lot of people don't realize this, but a woman named Patsy Mink, who was a congresswoman for many, many years from Hawaii, was one of the driving forces behind that. So whether it is the current issue that we have legislated to help deal with, or something going back in the day with Title IX, we have to sometimes bring together the power that a law, the power that legislation can apply to a situation and make sure that, in particular, young people are protected. We have a number of great panels. I'm going to get out of the way and let the experts talk, but we have two great young ladies who are going to be part of our opening panel. Where's Casey Thomas? Where's Casey? I want Casey, come on up. Casey is going to speak on her own for half an hour. They told you that, right? No, I'm just kidding. A colonial, St. Philip Neri, thank you for having her here with us. And from the great programs of Downingtown, Pennsylvania, another great youth soccer player, Kim Zeffert. Where's Kim? Come on up. And I was just kidding. No requirements. We're going to have a nice discussion. There are two gentlemen I'm about to bring up, one who's been a longtime pal of mine, and I can remember Primeau and I were talking about this out in the lobby as we were all gathering. It was quite a few years ago that we had a discussion when you were dealing with this issue in your own career, that we were talking a little bit about where this issue was going to go, because the one thing, and as some of you know, I work for the Philadelphia Eagles, and in football, but also in hockey, we've started to talk about this. The physics of collision and impact are never going to be reduced. It's just a law of science that as young people and not so young people get bigger and stronger and play at a faster pace, collisions are going to be more and more potentially dangerous and destructive and all. We had this discussion, and I can't tell you how much admiration I have for what you've done. And I'll always remember, and I didn't love you at the moment, but I was still an on-air nightly sportscaster when you took us into 5 overtimes, and that's okay. We got through that and all, and if you're a Flyers fan, as I'm sure many of you are, we loved you as a player, but we respect you even more for what you're doing right now to help the young people in this room, in this community. Let's give it up for one of the greatest ever to wear the orange and black, my friend Keith Primeau. Finally, Taylor Twellman's going to come on up here, and I think what Taylor's been doing is just is also remarkable in terms of Keith. You know, we love sports. We love what sports has done for a lot of us in a lot of different ways, but we have to, at all costs, maintain player safety. And we talk about that so inherently at the professional level, but in terms of the potential impact, the things we're doing with our young men and our young women are paramount to all of us. So here we have 4 great panelists. My role as a moderator is to just let you guys do your thing.
Wait, I don't get a round of applause?
You got
I know he's a legend.
You got a tumultuous round of applause. Part of it for the Flyers orange sneaks, man. Which
Listen,
is
I know what it's like to come to Philly, so I'm making sure everybody knows I'm a Philly fan today.
Casey or Kim, I'll throw this out to you to get started, and then the fellas can jump in. How important is it for you as a young person playing sports to know that there are many, many people, not just your parents and your family and your teammates and your coaches, but many, many people? How important is it to know that there is support for airing this issue and making you guys safe? Either one of you want to Kim, you want to start and just talk about that?
Sure.
Yeah.
It's a key point to know that you have support. You aren't alone in this. There's people to help you. You aren't just by yourself.
Like Kim said, it's awesome to know you have support and that you're not alone. Like, because when you feel alone, it's not a good feeling. It sucks. And
so to speak,
Yeah. I think everyone's been to a point where you feel so alone, you feel hopeless, and you don't know what to do with yourself.
Yeah.
So I feel like knowing that there's people, everyone here knows we have support.
I think it's important to understand that I personally feel as though I'm a statistic. You know, I listen to Senator Brown, and he discusses the statistics of concussions in soccer and the statistics of concussions in all sports. And when I reflect on my own personal experiences, I don't know what my future holds. And I know what I've been through, and because of that, I'm a statistic. And Taylor's the same way. I know my story. The first time I met Taylor was last month at a presentation at Villanova, and we were basically sitting across the table the same way, and every time he was speaking, I was nodding my head in agreement, and every time I spoke, he was shaking his head in agreement, and
well,
we really...
Of course I'm going to agree with him, right? I mean,
and we really could relate, because although we come from different backgrounds, we've suffered through the same type of events. But I'm a statistic because I wasn't able to take care of my issues. We didn't understand them well enough. Where in the case of the two young girls, we don't want them to be a statistic. We want them to be able to have a different path and a different course, because we managed the injury differently than we did as I was going through my personal difficulties, and the same thing with Taylor. And I think that's where we've come so far, is that we really have made a change. The conversations that Don and I are talking about when I was still playing was I was showing courage because I was fighting through my injury. But in reality, real courage is speaking up and having a voice and saying, I don't feel well, I don't feel right. And as the adults and the parents in the conversation, we heed those warnings and we remove them to play. Because at the end of the day, it really is just the game. It's really not that important, the outcome.
Senator Brown said something very interesting for me, and he said back in the day, and I chuckled in the back because August 30th, 2008, my life changed forever. I wasn't back in the day. And while we're all sitting in this room, it's great to see. I honestly don't care about the pro athlete. I care about Kim and Casey sitting next to me. Because the percentage of, we all know stats. I can say stats, I can show you slides, I can show you everything about the facts of concussions. But the one injury in sports, the one injury that changes your life is a head injury. And until we respect it and understand the effects of it, as I had a half-hour conversation sitting here with Kim and Casey. How old are you girls? 14?
14. 16.
16. They're dealing with stuff they shouldn't be dealing with. So everyone in this room, we're here for the first step. It's good. We're aware. We want answers. We want questions. But I promise you, Keith would say the same. My life's not the same. I haven't worked out in 4 years. I haven't seen a movie in 3 years. I've read one book. I'm 33. I was a pro athlete. I kind of knew what it was about. A 14-year-old, 16-year-old girl in your own program, and there's thousands of these girls reaching out for help, thousands of parents. So until we realize the effects of this injury, and I know everyone's going to throw your water bottle at me because I'm going to bring up a Washington Redskins player, but I'm not a Redskins fan, so calm down. But RG3 gets a concussion, hurts his knee. Now, I'm in the media world now, and it's a top 10 Twitter trending topic, is ACL. 2 weeks before that, he had his 5th concussion. No one cared. And he actually answered the question wrong because he forgot. He said he got a concussion against Baylor at Texas Tech or something in the 2nd quarter. And the reporter hands up and says, it was actually in the 4th quarter. He goes, yeah, whatever. We're more concerned about a quarterback's knee injury than we are about a concussion. So we're all here today. I'm here today. I'll answer anyone's questions. We'll talk about it. But I'm here because Casey, Kim, and the thousands and thousands of athletes at this age, this has to stop. We have to be educated. We have to be aware. and we have to have our recognition much better than what it is. It's 2013. We cannot be naive and think that this injury is like the ACL injury. It's like a broken wrist. It's not. My life has completely changed in 4 years. But I was a pro athlete. These guys are in 8th grade.
I have 4 children, three who have suffered at least one documented, and I have one son that's had 2 documented concussions. And the boys all suffered their concussions from hockey, and my daughter suffered hers from field lacrosse. And my own personal case history is I've suffered through 4 documented concussions. My first being in January of 1997 when I was playing for the Hartford Whalers. I was taken off the ice, spent a night in Hartford Hospital, showed up at the rink the next day, and I was told that I was not allowed to participate in active competition for 1 full week. And I thought, how novel. That is so exciting as an athlete to hear that they're concerned about my well-being and they're going to take care of me, only to get further into my own case history and realize that it's not a light switch, that after 7 days my symptoms didn't go away, yet I returned to play. My second documented concussion was in May of 2000 when I was hit at center ice, and I guess I was out cold because I don't think I was, but all I remember next was the trainer was standing over top of me, and I was taken off the ice on a stretcher. I stayed in a Pittsburgh hospital overnight, and 2 nights later I was playing in the Stanley Cup semifinals against the New Jersey Devils. And for me, it was where I feel I had the beginning of my demise. My third documented concussion was February of 2003, at which time it took me 6 weeks to return to play. And so now I could see the trend where it was taking longer and longer to heal and get better, only to suffer my 4th documented concussion in October of 2005, which I never returned. It took me 12 months of fighting to get back before somebody finally had the courage to tell me that although my effort was valiant, I would never be given permission to play the game again. And that was a tough reality for me, but that's what it took. It took somebody else to have the courage to tell me that I was no longer going to be able to play professional hockey. Going back to my children, people often ask me, do you find it difficult to allow them to go out and participate in competitive sport? And my response to them is, I mean, I suppose I could not let them participate in sport, but how much fun is it to sit around and do nothing all day? And as parents, that becomes the difficult question we have to answer. What is the right thing for our children? But once they suffered their concussion, I also felt that we handle it and manage it so much different than we did as I was going through my difficulties. I made the decisions when I was playing. Now we're making the decisions for my children. And we managed it the right way. They were able to return to health, and I was able to put them back into active and competitive sport. One story with my one son was we got him his baseline test. We as a program, my kids obviously, it's a different sport, we're talking hockey. The program that my children play for over on the Jersey side of the river, all of our children have baseline testing, impact baseline testing, and which I feel is very important, and that's a conversation we can have as well. We're 3 days into his concussion, and he's bouncing off the walls. And my wife and I are looking at each other, this is crazy. We got to send him back to school, we got to get him back on the ice. And so we took him back for his baseline testing, and he failed miserably. And even after going through my own personal case history, to almost put my child back into a dangerous situation was a real eye-opener for me. I realized that this is multifaceted. It's much deeper than asking a child if he feels better. It's much deeper than, do you have a headache? There's many different angles you have to come at this from. And it was imperative for us in this situation that he had his baseline test.
Kim, how do you feel right now?
Really, really sick.
Describe that.
I have a really bad headache. I'm really dizzy, and I feel like I want to vomit. Yeah.
Do you feel like that all the time?
Yes, my symptoms haven't gone away.
How do you sleep at night?
Lots of sleeping medicines. I won't sleep if I don't take them.
Casey, how do you feel?
I'm fine right now.
So you and I were having a conversation about today. You didn't take your medicine,
No.
and you kind of had a blah feeling.
Yes.
Describe that.
Well, I'm on antidepressants right now. And I slept over at my friend's house last night, and I forgot to pack my medicine. And so this was the first time that I forgot it, and I can't take it in the middle of the day. And I didn't take it, and I just wanted to sit in my room alone, away from everyone else. I didn't want to talk to anybody because I was just dwelling on the fact that I'm never going to play sports again. And it sucks. It's frustrating, and it makes me angry, and I like to throw things. And like my one escape is playing piano. And like Taylor was telling me that I can't play piano to feel sorry for myself. I have to play piano to turn another corner and say that things will get better and things are progressing and I'm getting better. So.
Can we give these two girls a round of applause? They're pretty young to tell a story like that. I can sit up here and tell you about my stories. Keith can tell you about his, but I think that tells it good enough. Keith brings up a very interesting point about baseline testing. I've taken it over 60 plus times in a 3-year period since August 30th, 2008. I never failed it once. So for all of us that agree with baseline testing, it's very important. But remember this statement. It is a tool. It's a tool. Just like anything, I can ace a test, ace a quiz, and fail the test, right? So I passed every test. So any one of us that takes our athletes, our kids, to the doctor, and a doctor says, well, they passed the test, they're okay, I'm going to say, make sure you do your due diligence and make sure you second opinion, ask other questions. Okay? I'll tell you a quick version of my story. I ran into a goalkeeper. It was my, first of all, I have the largest head in the history of soccer. So my head got in the way more often than not. So I ran into the goalkeeper August 30th, 2008. A bunch of people there. My family was there. David Beckham was playing, and I know he was pretty hot, girls. And so Beckham, Landon were there. We were in Boston. A bunch of people were there, and my family was there. And in the second half, I continued. I went to the sideline. Now, keep in mind, August 30th, 2008. And I counted down. They did the follow the finger, count down from 100. Oh, yeah, Taylor, you're fine. Go into the game. It was about the 70th minute, and I thought I scored a goal. So I took a shot. I turned to celebrate. My best friend on the team, Steve Ralston, looked at me and goes, dude, what are you doing? I'm like, what do you mean? We're winning the game. I just scored. He said, that missed by 5 yards. Double vision started. For the next 7 weeks, I played 8 games. I have dealt with every symptom post-concussion you can think of. I took shots of Toradol to mask my symptoms. I saw countless numbers of doctors. I was diagnosed with diabetes. I was diagnosed with post-traumatic stress disorder because I didn't go to England on my $3 million offer. You can tell I've gotten over that. I was 28 years old, but what was interesting was I was 1 goal away from being the fastest player in the history of MLS to score 100 goals. And the first question every doctor asked me was, you think you're going to get that 100th goal? Now, I'm just like Casey, just like Kim. I'm not sleeping. One night I sleep 14 hours. The next night I sleep 3. I'm throwing things because I'm angry. I'm sitting in a dark room looking for answers. It took me about 8 weeks of sitting in a dark room. And for the kids out here, and I've told this, and this is with all due respect, this is my story, I dealt with a little bout of taking OxyContin to try to battle the injury, get rid of my headache, feeling blah. I did antidepressants, didn't work, nothing worked. And in 2009, I made a decision that I'm going to beat this. But then my next door neighbor was Junior Seau. And for those of you that don't know Junior Seau, Junior and I went to dinner twice a week when he was playing for the New England Patriots. And he was at the game. I got punched in the face. And he saw the injury report and went to a Revs game, and I wasn't there. And he was asking me, so he calls me and says, hey, let's go down, let's grab dinner. And we're in there, and he says, buddy, why aren't you playing anymore? I said, I don't know, Junior, something's off. I don't feel right. I'm sleeping, I got a headache. And he looked at me and he says, buddy, I've had a headache since I was 15. It's a middle linebacker in the NFL that had zero diagnosed concussions. Are we that naive on April 21st in 2013 to believe that guy had no concussions? He drove his car off the cliff, said he fell asleep at the wheel. I never heard from him again. I sent him 20 texts, 20 phone calls. Keith is an example of he's going to beat this. I'm going to beat this. But what's most important is I'm going to beat this naturally, and I'm going to beat this and be an example for Casey and Kim that we can do this. But it's all of us in this room have to do it together, because what I've noticed from Kim and Casey, and that's why I asked them how they felt, they're both different. If all four of us walked into a doctor with a torn ACL, 99.9% of them are going to be handled the exact same way. Concussions aren't. Concussions are not the exact same. Keith's story, my story, completely different. I asked Kim 3 questions. I'm telling her my story of how I can try to help her. It's a different story. So you have to be educated. You have to know what a concussion is before any of us as parents, coaches, players, or anything can help each other. I think that makes enough sense, doesn't it? But we've got a 14-year-old taking antidepressants because she can't figure out why she can't play soccer anymore. And we've got a 16-year-old that wants to throw up on one of the best NHL enforcers, which, by the way, Kim, I'd throw up the other way. But the reality is we're all different here, but there's the same story. We need help. We need help. And the only way we're going to do this is a collective effort. And I believe in my heart of hearts that we can change 2 things with concussions: the recognition and rehabilitation of concussions. Listen, I live in downtown Boston, 3 blocks from the bomb site last week. 2 of my friends are seriously injured. They're going to live. What I'm bringing that up for is this. None of us are going to stop going to marathons. None of us in this country are going to stop going to the movie theater. And none of us are going to stop sending our kids to school. None of us should stop playing the sports, youth sports. There's so much good in it. But how can we put an 8, 9, 10, and 11-year-old boy or girl on the soccer field if they don't know what they're doing and if the coach doesn't know what they're doing? I don't care about the 33-year-old hockey player. Sorry. He's a grown man. He can know. He
41.
knows what he's doing. 31.
41.
41. Well, you'd look good. Damn. Notice how I went down on that. My point is this, is that soccer, hockey, cheerleading for girls, football, we can't lose sports. But we also can't be naive enough that we have 8-year-olds and 9-year-olds heading the soccer ball 20, 30, 40, 50 times a week. I raised this question for you. Little League Baseball has the 60-pitch rule. If you throw 60 pitches, you have mandatory to sit out 3 to 4 days. Then someone tell me why we don't have a head count rule. We are more concerned as a society about a rotator cuff and an elbow right now. Think of that. But yet we're going to send our sons and daughters to hockey practice and they're going to have checking, soccer practice, they're going to head the ball 40, 50 times? Come on. When I go to Europe to do games for ESPN and I look at what other countries are doing, they're not heading the ball 30 to 40, 50 times. There's, in our sport, all of us in this room, there's a byproduct to this. You don't lose your sport if we tame heading until they're old enough to head the ball. You become fundamentally better soccer players. The sport doesn't die. It's the number 1 sport in the world, pickup-wise. I'm telling you, watch anyone that's played the game. They go to South America. They go to Europe. They watch pickup games. They're not heading the ball. The ball's on the ground. It's futsal. But yet I did 2 years of going to youth games, and that's uneducated. It's not teaching the right technique. All of us in this room that have someone under the age of 12, I want you to throw a moving object at their face. What's their natural reaction? The kids go like this. And we're like, no, stand there. And the 9-year-old kid's going, what, Dad? Coach, what are we doing? It all goes back to education for me. I think we have to be much more educated. The sport's not going to go anywhere. There's so much good in sports. I can guarantee you, Casey's never going to play again. She's going to be part of the sport somehow. She's going to be a coach when she starts feeling better. And she's most importantly going to tell this story, which is what all 4 of us are doing. So you guys are here today. There's great panels here. We're going to have some medical professionals. We're going to have coaches. So I'd have an open mind to it. But it's one thing to listen. It's another thing to put some actions to those words.
It's about the cultural change that needs to occur. As I was going through my dark days and trying to understand where do we go to make a difference, ultimately we make a difference by understanding and respecting the injury. And how do we do that? We do that by educating ourselves. To say that we haven't come a long way would be an understatement. To say we have a long way to go would be another understatement. We look at the professional athletes now, and I know we're not here about professional athletes. I'm with Taylor on that 100%. But when a player gets hurt now, we pull him out, and we want to make sure that he's okay before we put him back into competition, which is a huge 180 from where we were 3, 4, 5 years ago. And again, that draws a comparison to our children. Why is that not happening 100% of the time when our children are put in that situation? And I think that becomes the biggest paradigm, is that we have to make sure that if we are putting our children out there, that we're not putting them at risk. And how do you do that? You do that through education. And that's, I think Taylor's one of the most eloquent speakers I've ever heard on this topic. And what he preaches is the gospel. It really is. It's the information that we need to have in order to make change, in order to keep our children safe.
Guys, how about for our first panel?
Yes and no. Okay. So there's a lot more people have heard of concussions, so it's familiar. But when it comes to the nitty-gritty of it, I find that there's still a lot of misinformation, and parents and athletes don't really know how to navigate the system once something's been diagnosed. Okay, what do I do next? Where do I go? Who do I see? How do I get better? And so that's where, okay, well, you shouldn't play, but now what? So that's kind of what I've been seeing. I don't know about anyone else.
I think we recognize that a concussion is a brain injury, and each brain injury is like a snowflake. They're all unique. And so if someone knows, well, my uncle had this, and so therefore it must be like this, that may be true for your uncle, but it may not be true for the next person. And so I think that we're recognizing, especially in youth sports, that there are some mild concussions, and they all get better quickly, and there's some more significant concussions that don't get better quickly. And the worst concussions are probably the concussions that occur that aren't recognized. There's a re-injury, and then you end up like the 2 young ladies who were here before us. And so I think the lay press has done a pretty good job of talking about concussions, but the information isn't always accurate about concussions, and there's a lot of information. And so I think my patients who've had a second or a third concussion, they come in, they're really great. But the ones who I've never seen before may not have the same understanding. And to put that in perspective, I saw a 9-year-old today. He had his 4th concussion. He's a very active young man, and these were all sports related, but free play sports related. And so the first concussion he had, he saw me, it took him about 4.5 months to get better. And this last one occurred a week ago, and he came in today, he said, I feel completely fine. And I was talking to the parents, I said, well, what do you think? They're like, I'm just amazed that he's so much better. We've been through this too many times. And they're right, it's been too many times. And he said, But this time we did all the right things, and 4 or 5 days later, it's just amazing where we are today. So he's not 100% yet, and he's not cleared to go back to play, even though he asked me if he could play today, because he's 9 and he wants to play. But I think that's the part of what we're seeing. And concussions are occurring at young ages, and quite honestly, I don't want to use up. If you get a couple concussions in life and do fine, I don't want to use them all up early, especially because we did the wrong thing.
What I'm finding is there's access to more information than there ever was before. There's websites to go to, there's support groups, there's more information, there's more awareness in the media, but people aren't always taking advantage of that. Especially the younger kids, they're still not understanding how to speak up for themselves, to be their own advocates, and that's one of my missions. So I will go into the local high schools and I will present right to the kids, right in front of the coaches and in front of the parents and the teachers, that if you're feeling something, speak up. If you notice one of your best buddies isn't himself, you have to speak up. So I think that's the big message from tonight, is that if you're feeling the symptoms, if you see something, say something.
At the very beginning, we don't have long-term research. I think the professional athletes have called this into play because athletes who sustained concussions 30 years ago are having problems, but they weren't tracked 30 years ago to today. And so we're in the beginning of tracking them. And at the professional level, they have resources and they'll be getting tracked. But we haven't been tracking youth athletes. And we talk about professional athletes and college athletes, high school athletes, younger. We have to remember that there are 40 million kids who play organized sports, 8 million kids who play high school sports, and a couple 100,000 people at most who play professional sports. So the majority of the sports-related concussions are occurring in high school and younger athletes, and we don't have hardly any data on them. So people ask me, well, should I stop playing? Should I keep playing? The answer sometimes is I don't know. There's certainly risk signs that we discuss. If we think the recovery's been pretty good, if we think the injury was mild, then we go back to play. But people are asking me, can I go let my son get another, or my daughter, get another concussion? If they go back to contact sports, I'm kind of sanctioning that it may happen again. So we have to think long and hard about how many are too many. And we don't have the great science. So it's a problem. And we're still learning. There was a paper that came out this weekend. I just got back from a conference, one of our national conferences. And they talked about kids who go to school full-time right after the injury. And the paper presented that they do worse than the ones who stayed home for a couple of days or had some modifications right away. So 10 years ago, no one said that. And if I was the person giving the advice 10 years ago, I might not have said that either. And so what I say today is unfortunately better than what I said 5 years ago. And hopefully what I say 5 years from now is better than what I say today. So we will be guided by research, but we're just at the beginning of that. And so we don't always have all the right answers.
A lot of times what we're doing is using the SCAT-2 or a graded symptom checklist. So you go through, and what I'll ask with my athletes is, how did you feel during school today if you happen to be in school? So you'll go through the various symptoms and you can grade them from 0 to 6. But I'll even ask them, in class, did you have any problems? And then how do you feel now? So I'll utilize it kind of twofold. If the kids are not in school, what's being done is to run them through that at home, especially if they're being tutored at home, so that they can go through and after their math tutoring, how did you feel? Were symptoms elicited? And then what can potentially be done to help minimize those? What I've found with more of the longer term cases is that when using that, you can look through on a daily basis and say, you know what, your symptoms, your headache yesterday was a 5. But today we're down to a 4, and you can help to watch the symptoms either decrease or increase depending on what they happen to be doing. And so I find that it provides more of a light at the end of the tunnel for something that seems endless and really long and frightening. And so that's what we've been doing. So not quite like journaling, but keeping track and what makes things worse or what makes things better.
In my setting, by the time I'm seeing them in the physical therapy setting, it's by definition of time, it's into that chronic phase. And I don't treat diagnoses. I don't treat concussions. I treat a patient, and I treat the whole patient. The first day we find out, what is it can't you do? because everyone's going to have different answers. Some of the symptoms will be the same, the dizziness, the nausea, the vertigo, the headaches, the depression, but what is it functionally that they can't do? And that's what I help them get back to. So when I first see them, we have the list of what they can't do versus the list of what they can do, and then we're trying to make that list change. So journaling is very important because it helps me guide their program to works for them. One patient very recently, she had a concussion 2 years ago, and one of her big goals was being able to go to a concert with her friends and not pass out. That was her goal. On the other side of it, I had a police officer, and his goal was to be able to return to riding a bike again. So both had concussions, but very different goals. And so that's the point of keeping those journals. If the more information that we have as clinicians, whether on the medical end or physical therapy or the athletic training, that tells us exactly where we need to step in and give the right intervention. It's a huge problem. I had a young man who actually had a house fall on him. And he wasn't wearing a hard hat, had a skull fracture, he was in the hospital. He told me the list of friends that came in on that very first day to see him, huge, they were around the clock, people, well-wishers, you know. When he finally got home and discharged, his number of friends went from about 35 to 1 because they kept asking him to come out and play, and he was like, I can't, I just gotta sit here. I just gotta sit here in the dark, I really can't go out and play. And they couldn't understand why he wouldn't be their friend anymore. And he lost all his friends, except for that one that kind of understood, because their knowledge of what concussions are and their culture was, well, if you're not bleeding, you should be out playing. So they didn't give him the time to be who he was. And you know, ultimately, when his personality came back and he became who he was again, he was able to go out and engage and make friendships and renew some of those things. But it was a very, very dark time. He was very alone. You know, fortunately, he had one of the best parents that worked together to help him. His mom would sit with him on the porch. They'd do little puzzles together. So they made it their mission to get him better, and that's what kept him alive.
You're referring to chronic traumatic encephalopathy. Okay. And that's what they've been doing. It's a big project in Boston, and there's one in Chicago. And our own Andre Waters had an injury and committed suicide and was found to have missing a large number of brain cells. And so that's really premature aging of the brain. So when they did his autopsy, they described his brain as looking like an 85 or 90-year-old. So someone who's kind of run out of cells, if you will. And the concern is that repetitive hits to your head accelerate that process. We don't know if those are concussions or if that's just total cumulative hits. And so there is a concern that if you hit your head 1,000 times or 10,000 times, maybe that's just too many, whether you get a concussion or not. And so I think that research is starting now. And that research is a little bit scary because it may have implications for how we do things at a lower level. Because if you say there's a cumulative effect of getting hit in the head, then when do you start the clock? Do you start it at 9, 11, 15, 22? So we're talking about, do you change youth sports, or do you just say, okay, you can't have collisions in youth sports because we don't want to stop the clock too early? We have some preliminary data on concussions, and the reality is most concussions recover with no long-term problems. And certainly 1 and 2 concussions, most people do really well. I think the problem is when you get an injury, you're not better, and you try to play again. And I think we heard Keith and Taylor talking about playing while being symptomatic. And so if we have a youth athlete, a youth student, who gets a concussion at age 11, and the coach says, how are you? Most kids who want to play say, I'm fine. If we say, do you have a headache? Do you feel nauseous? Do you feel dizzy? They might say, yeah, it's okay, then you just don't play. But if we say, do you feel fine? They say yes, they get put back in the game. And then there's another collision, they get re-injured. That re-injury is worse than the initial injury. And so we don't know how many of these long-term sequelae are from guys who got smelling salts and then went back in the game versus a couple people with had isolated concussions. If we look at who's on that list of players, fortunately we don't see too many non-collision athletes. We see ice hockey players, we see boxers, we see football players, but we don't see soccer players who had 3 or 4 concussions in their career. We don't see lacrosse players to the most part. Whether they're out there and we're missing them, I don't know. We'll certainly have to look. But what we had as a culture in the 60s and 70s and 80s, and getting guys back into play, and maybe even in the 90s and early 2000s, hopefully is different today. And so what we're really hoping from this is that if we recognize a concussion early and get kids out and don't get them re-injured and have them go through their rehab and have them get back into school first and then get them back into sports second, that a lot of times the outcomes are really pretty good, even if they have a couple. But if they get injured and don't go through these things, and you cursory say, are you fine? And they say yes, and they go back and play, then we have these catastrophes that are preventable. And so really, you know, I applaud EPYSA because they've stepped it up a notch. What they've said is it's not good enough to say, are you okay? The coaches have to go get education. You have to learn what the signs and symptoms are. And if you suspect that your 11 or 12-year-old who may not advocate to get pulled out of the game, but will probably advocate to stay in the game, if you suspect they have a concussion, they have the symptoms, then they have to get evaluated. And that game isn't, quite honestly, worth it. And so I think if we get to the point where we can manage concussions better, maybe we won't have some of the long-term problems. But we didn't manage concussions well for an era. And hopefully that era is over, but it probably isn't over everywhere. And I think the other thing that EPYSA has done that other organizations hopefully will follow lead is that the law applies only to scholastic athletes. It doesn't apply to club ice hockey. It doesn't apply to club lacrosse. It doesn't apply to club football. And so those coaches are not mandated to get education. And so, you know, EPYSA is setting the bar high to say, we want all our coaches to do this. And I'm a youth coach. I'm an EPYSA coach myself. I have an 11-year-old son who plays travel soccer, and I'm his travel coach. And hopefully I do know what the signs and symptoms of concussion are. And if he gets a concussion, maybe I can even do a silent assessment. But I think the point is, in the youth world, I'm his coach because I'm his dad. And 10 years from now, somebody else's dad is going to be the coach. And that somebody else's dad may not be a doctor with this kind of training. And so every 5 or 10 years, we're going to recycle all our youth coaches. And so if the organization doesn't make a point of saying, we want this to be a process that everybody does, it's great that if we trained every single youth coach today, that'd be great. But 10 years from now, we'd be starting all over again. And so this kind of thing of making sure that if we have a concussion, we identify it early. Maybe we're not talking about chronic traumatic encephalopathy that started as a youth player because they kept getting injured and we didn't recognize it. I think there's been a void. I know that at the Children's Hospital of Philadelphia, 2 years ago, we started a support group, which means before that we didn't have any. We have support groups in the Bucks County area, and we have support groups in the Philadelphia area. I know that other institutions like Bryn Mawr Rehab has set up a support group in their catchment area. So I think we're starting to get there. And the reality is there's a lot of people like Kim out there, and Kim may have her own support group. Sometimes she finds her own. And so I think we're getting better at doing that. And I think it helps them, if they have a support group, that they recognize they're not alone. Because unfortunately, anxiety and depression are part of chronic concussion symptoms. And I send people to Ned, so I actually know Ned, and he can get better at their eye tracking and their balance problems. But sometimes it takes friends to help them get through the dark times, and having people who understand what they're going through is pretty important.
I think it's another thing that is in its infancy and it needs to be developed more. What I do in the clinic is if I know I have patients with concussions, I try to get them in the clinic at the same time so they can become friends kind of organically, and that helps them to have somebody on the treadmill next to them that's going through the same thing that they are. But we could do more, definitely.
Check in the school systems too, because a lot of the high schools and middle schools and potentially even younger, but within the district itself, are starting to put together some things so that the kids can come out and, like Ned was saying, you know, he tries to bring the patients in together. I'm an athletic trainer, so I try to kind of pair up the kids that are going through their progression or low-level activity only and bring them together so that they can talk about, and it is hard because you lose your team almost. So if you bring them together with somebody who's suffering from the same thing, you can kind of find some of the same feelings and the same frustrations that you don't see with your other teammates. I think you're going to see that regardless of gender. Right. I mean, ultimately, when these kids are looking at their future, they're not seeing how their brain is going to function later in life. They're looking at the education that they may not otherwise receive. So if you have a football player who they're never going to go to college, they can't afford it, but they get a full ride, and then you're on that sideline trying to make a determining factor, they're not going to report as much. So it's better sometimes to err more on the side of caution and say, you know what, I'm not feeling real comfortable with putting you back in just because. Does everybody tell me the truth all the time? Absolutely not, 100%. So if you look at that potential for a little fabrication and then to know the athlete and know the pressures that are being placed on them, sometimes it's better to kind of make that executive decision on their behalf and ease that pressure off of them because they're not going to be necessarily honest.
Phenomenal. Phenomenal. Let me, before I dismiss you,
I'd like to say I was smart enough to say early on, but I think it was, we've talked about sort of the culture of sport, especially I'm 50 now, so roughly your era, and I don't remember that at all. I guess I felt that that was just part of it, that you, whether it was a bruise or whether your head hurt, it was just time to go back in. And I guess I don't, I'm not that old that, was totally rub some dirt on it and get back in there, but I did come from a time that I think I was sort of at the tail end of this. You had mentioned salt tablets, but I remember high school football being, the water was basically rationed to us. So we'd be out there in August for double sessions, and you would go up to kneel down, and the trainers, if they liked you, they gave you a little more squirt of water. And I remember going to college my freshman year, and there were water jugs everywhere, and I thought it was like a trap. I would go up to the water like, am I going to get yelled at if I drink this water? So, and then as I went into coaching, I saw that sort of transformation of the, not overdoing it when there was an injury and really thinking more about the kid's perspective. But when I was young, it was just what you did. And I realize now how silly that was. Now I'm a parent. I've been a coach for many years. I've been an athletic director for 10 years. And I realize how far we've come, and I know how much further we have to go. But I think the awareness of parents and coaches and even the kids now, that because of the the many media outlets that you see this important topic and how important it is to communicate, if you are feeling even the slightest bit dizzy or what have you, has really gotten the ball rolling in the right direction. But for many years it was, because you couldn't see it, you just played on. That was just kind of how it was.
I definitely think so. I think the awareness of the concussion syndrome is more prevalent now. I think we have the luxury in the college level of having athletic trainers. We have doctors. We have a lot of things at our fingertips. So as coaches, we defer a lot to those professionals because we don't necessarily have the knowledge. So we have that advantage over the youth coaches, but I do think that there is pressure on women, young women, to push each other and to get the best out of each other. But I also think that there is a level of awareness now. There's a level of knowledge that says that internally they say, you know what, wait a second here. You don't feel right. I'm going to the trainer and I'm taking those measures. Or I'm going to call coach and see what's going on, tell her what's going on. And I see that more and more happening as opposed to, I think so. I think, because I'm hearing it more at our level, that there's more of that going on. And we get a lot of, we have an open door policy, and the kids being aware of these symptoms, whether it be if a kid gets hit in a game, she might not feel it right away. And then all of a sudden 24 hours later she has a headache, she can't concentrate, they go immediately to our trainer, and because they know now. They step on campus, and the training room is very, very accessible to them. They're very knowledgeable about the subject, and it's because of all of the people that are here today that are making this known. And when I played, it was a very clean sport. If you go back and you watch game film of when we played, it was very clean. Nobody touched each other. There was no bumps going through the lane. Now in the last 2 years, we've put in 2 rules: a flagrant 1 foul, which is any elbow above the shoulders, and they get a technical foul. It's reviewed, the whole thing. So that is a point of emphasis. The arch in the lane, you saw it in the NBA, the charge circle. That we're 2 years in with the NCAA now. As far as a secondary defender stepping in, if there's any contact, it's an automatic defensive foul as opposed to an offensive foul. So those things are changing. The awareness has emerged, and those calls in the game, they're not accepted. They're immediately called, and they've done a really good job of that in the NCAA.
Well, unfortunately, I think soccer is probably the most guilty of training 12 months a year. And also picking up kids at 8 and 9 years old, telling them they have to train 2 or 3 nights a week and then go for individual training. And to be honest with you, I think sports-specific training is not a good thing for young players. And just like ankle injuries and knee injuries can be attributable to overtraining, I'm convinced because technique breaks down and kids become tired, and they have professional coaches telling them what to do all the time, that it's contributing to the concussion issue. And it's something I think parents should be aware of and make proper decisions for their kids. I mean, I have personal opinions I'd love to share. I don't know if this is a place to do it, but I think that's a contributing factor. And also Taylor brought up something important, is you don't have to teach heading at young ages. And this is just a selfish thing coming from a soccer coach, but our first touch as Americans is horrible because I think we get involved with heading at an early age. Kids should be pulling balls down with their chest or thigh and their instep and playing the ball on the ground, as Taylor mentioned. So I think teaching the proper technique is critical and won't contribute to the concussion factor the way it's happening right now.
As athletic director at LaSalle, we have 16 programs, and there is some leeway for each of the coaches to sort of, in their preseason parent meeting, specify, I don't know, maybe this is the wrong term, but sort of appropriate conversation, and the physical well-being of their son. LaSalle's an all-boys school, is one subject area that is always open for discussion. Things like playing time and who makes the team, that's really more the coach's discretion, but whenever it comes to the health or well-being, mental or physical, of a student, then the parent is absolutely encouraged to speak to the coach, and if the coach isn't giving the proper response, then they should go another level to the administration. So, and I think coaches in general, and again, it's such a, some parents, you mentioned parenting, I heard a good line a few years ago that the most competitive sport in high school is parenting. So some parents will use, well, my son, whatever, tweaked his ankle. Oh, and by the way, how come he's not playing more, or what have you? So it is a fine line. But again, I just think the general awareness, and Cindy mentioned it, of concussions in particular, but just that parents are more aware and the coaches are more open to conversation as long as it's pertaining to the health of a student. And I think, at least I hope, and I feel it's true at LaSalle, that the coaches and the parents respect that's sort of a whole separate issue from kind of the wins and losses and, again, playing time and those types of topics. So.
Well, I'm sure there's a lot of coaches who meet with the parents of their teams, but within Eastern Pennsylvania, we offer coaching courses. And we try to instruct coaches how to go about meeting with parents and discussing risk management issues like concussions. And usually that's a pretty productive way of going about things. But I think it's important for parents to realize, and this is critical, that you're not going to be measured as a parent on wins or losses of your child or winning the Delco League B division. You're going to be judged as a parent on how productive and how happy your children are as adults. And I didn't have that perspective as a coach and father, okay? And because of that, I made a lot of mistakes. And I can see that now with a lot of parents of young players too. They feel this huge commitment to get their kids out and playing all the time, imagining things are going to be successful and offer scholarships and things like that, and not looking at the general welfare of their own children, okay? And I'm talking from somebody who's guilty of this. And I try to get that message out to as many coaches when I do my coaching courses and clinics throughout Eastern Pennsylvania.
Well, I think for our sport in particular, I mean, we play below the rim. So there's, you know, our excitement is the 3-ball. So there's not a whole lot of contact in that situation. But the things that do make it are the dunks or, you know, a lot of high-flying situations. But definitely in the men's game, that's what sells tickets. That's what little boys and girls want to do. You know, Brittany Griner dunks now. You know, so there are women that do dunk, but she's not dunking over another 6'8" person. It was a very clean dunk, if you will. So it is glorified. You know, it is glorified. You know, I think there's a lot of things that aren't glorified. You know, the coach throwing the ball at the kids' heads, you know, that was not a glorified thing. So I think you have both ends of the spectrum there, but, you know, either way, I think we all have to keep things into perspective. I have 3 children of my own, 2 of which are 2 girls, which are in the youth soccer league here. And, you know, I think as parents, you do get, I mean, I'm a coach and I'm a parent. I don't coach my kids, but you do get caught up in it. And if you go along with, are they having fun? Are they having a good time? Are they doing what they want to do? And you're not pushing them out the door. I think we're all in a great situation. They've got to want to do it. And once it gets to the point where it's not fun anymore, and you know, you have to question whether they want to do it. Why don't they want to do it? Find out why they don't want to do it. You know, or are there pressures from other areas? Is it they're not feeling good, or you know, did something happen at school? But you know, I think you have to, as parents, you have to really separate that. Be their parent, don't be their coach, and you know, make sure that they're having a lot of fun. I don't know if I really answered your question, but
No, you did.
And Tali, if I can chime in on that, I'm actually coaching my son right now, and last spring he had a concussion, ironically, just as fate would have it, and it was unique. As an athletic director and as coach for many years, I've been around a lot of kids and helped kids through that process, obviously with our trainer being the point person, but when it was my son, it was a very interesting process. And as his dad and his coach, he wanted to charge right back out there as soon as he felt better. And, you know, again, I'm not old school, but kind of old school. And I was like, well, I guess if he feels all right, he had done his baseline testing beforehand and retesting and was fine. And, you know, his mother was like, he's not going back out there. And I said, well, I don't, you know, you get into that question of it's not an ACL, it's not a broken wrist. So even having been around sports for a long time, I was at a little bit of a loss, you know. And again, the old school part of me was like, I guess if he's ready, let's get him back out there. But you know, the voice of reason, as always, my wife, was sort of like, it's too soon, and you know, we had been to the doctor, so it was a very challenging process. And you know, you kind of do the best you can and cross your fingers a little bit. I will say both of my sons played football, and my youngest is a senior this year, and I grew up on football. My dad coached football for 40 years, but there was a side of me when he played his last game that I was like, I'm glad, you know, because I love football, but as you said, people are getting bigger, faster, stronger, collisions are bigger, and you know, lacrosse is a contact sport, but not the same as football. So again, as a dad, I was sort of like, it was a great time, and I enjoyed watching him, but there's a big part of me that's happy that he's going to just go, and hopefully if he wants to play college lacrosse or when he gets older. So.
I don't even think, not just the coaches should be more receptive, but also what's happening within the schools is I don't think teachers are as receptive to kids with concussions as they should be. In fact, I used to be a special ed teacher, an educational diagnostician, And the more I think back about all the kids I've sat through with IEPs, and I'm looking at him thinking he has an auditory discrimination problem, or he has some emotional issues, or he has depression issues, or ADD issues, we never discussed did this kid have concussions previously. So I think it has to be an educational process, too, that we're educating our teachers to recognize this. And I forget your name, I'm sorry. Kim. When Kim, I talked to Kim about teachers not, when she came in and explained to these teachers that I'm having problems, their first reaction is, okay, she's making up some excuse, and that's the way I think a lot of teachers would perceive it. So I think it's important not just letting parents and coaches, but also getting the teachers to make sure they're aware of concussion issues with your children.
And I'll interrupt again.
So Tony, jump in.
And I just wanted to, again, I'm sorry to keep jumping in, but dovetail with that because I'd said I've been the athletic director for 11 years, and this year I moved into the counseling department. I'm the freshman counselor at LaSalle. It's called jumping from the frying pan into the fire, as they say. And it's been fascinating because now in that role, we've had at least 8 students, I was thinking of this today, that missed days of school because of concussion related, not only sports related, but, well, sports, but snowboarding or sometimes things outside of school. And again, the parents seem to be much better informed. The teachers, quite honestly, are, I think, well, as Mike said, sort of just catching up now. Some are like, okay, no problem, just let us know what, you know, I'd send an email, so-and-so's going to be out for a few days, he had a concussion, we'll let you know. Other teachers are more, well, how am I going to grade him? How am I, you know, he has papers due, or we have a test he missed, and which is obviously the absolutely wrong way to approach it. But again, I think even the teachers it will become just more common procedure. If a student is missing a few days and they can't look at a computer screen or they can't read without headaches, then we're going to wait, and as long as it takes, then when they're ready to resume their schoolwork, and then we'll figure out a timeline and try not to overwhelm them with all the tests they have to make up. And that's just, again, part of the learning curve that I think will go on in every school in terms of communicating the issues that are related to concussions, but then sort of the school helping support the students as they transition back into, you know, we think about the athletic side of it, but also the academic piece of it and their social life and, you know, the various components that any young person. I don't know whether legally or not, it is certainly honored within the school, and I'm usually the point person to help disseminate information in terms of timeline to our teachers, or, you know, that are teaching this particular freshman. But again, I do think that this is very new. I think some of the teachers are not sure how soon can I give them the test. I mean, again, some teachers are just like, fine, you know, we can skip that quiz, and we can, they're very supportive, and majority are, but some are a little more by the book. And it's, I've never felt that I've had to sort of go to a teacher and say, wait a second, you really, do you know what it can go, you know, what's actually, how much this is, how, you know, hard it is to come back from something like this. And
very few kids that are going to fake post-concussion syndrome, because it's like nothing else.
No. Although I will mention one thing that I'm getting, and I've heard this at the college level. I was told that some of the kids, or, you know, I hope, hopefully not LaSalle kids, because we try and tell them how important the impact test is, that some of them are sort of tanking it, for lack of a better term, so they can get, if they got a concussion, they'll score higher than their baseline and be able to get back sooner, which obviously is.
Manning came out and said he and the NFL players were cheating the impact test.
Right. Well, that's kind of everything good and bad filters down, you know.
It's actually proven in the impact test. If you take it and then you take it again, it shows it. It doesn't.
Right.
There's no such thing as acing the test. So if you take it and then do really well,
that's another flag.
That's another flag.
Yep.
And so then the NFL came out and was like, well, wait, and Mickey Collins from Impact was like, well, wait a minute, that makes no sense. If you're taking it and then you take it for real,
right,
it doesn't add up. So
yep.
I'm glad you made that point.
I think that's a great idea. I think that's, you know, our kids have a voice, you know, just like we all have a voice tonight, but they are in front of the community all the time. And I think it's a great idea. I think it's something we will definitely look into. I also think when we go to, we just got off the road, we were at a big evaluation weekend, if you will, so all the top kids in the country, and they are required to go to an NCAA informational session before they compete. And in order for your event to get sanctioned, all these student athletes need to participate in this. So why not add that to the NCAA requirement of not only do you have to know the rules as far as recruiting, but you really should know some medical rules as well. So that's a great idea, and we can certainly look into that. Mm-hmm.
I'm the mother of a son who's had 4 concussions. And so really 2 brief comments, just because I don't know how to ask it as a question. One is, I guess, Dr. Grady, I'd like you to comment on the word mild. Because every concussion he's had has been termed a mild concussion, and yet he's now 2 years out from the last concussion and still in rehab. And I also wanted, you mentioned the parent who did the right thing after the concussion. I'd love to hear what the right thing was. And you talked about support groups. I want to tell any parents in here that support groups are just as important for the parents. And I know of 2, one at CHOP and one in Doylestown, where there's one group for the teens or maybe younger and one for the parents. And it's mind-blowing for both. And the last, I don't know if I'm doing too much. The last is for coaches. Now, I've got this son who all he has left is baseball. And when he goes back to try out for baseball, I've got to fill out a form that says he's got post-concussion syndrome. And he doesn't get picked for the team. Now, I don't know why, but there's this question for coaches. If you know a child has had multiple concussions, where does that put us as parent and coach together to be honest about that with a kid who really does need to play something, but we as adults also want to protect them?
So I'll address the first one about traumatic brain injury. So we have mild, moderate, and severe traumatic brain injury. Concussion is in the spectrum of mild. When I talk about injuries, I say you had a concussion, and if you recover quickly, it was a mild concussion, and if it takes a moderate amount of time, it was a moderate concussion, and if it takes a long time, it's a serious concussion. And so we used to grade them, and we found out that the idea of grading is that if you have a grade 1 MCL sprain, that means it's a stretch injury. If it's a grade 2, it means it's partially torn. If it's a grade 3, it means completely torn. So we all understand these grade 1, grade 2, grade 3. The problem is, if we start saying grade 1, grade 2, grade 3, it kind of implies severity. And we realize that grade 1 and grade 2 and grade 3 doesn't apply to concussion anymore. So there's about 14 previous grading systems. We've thrown them all out because they don't work. And so your child did not have a mild concussion if he has symptoms 2 years later. The same way that if he was involved in a car accident and his head went through the windshield and he got better 3 weeks later, maybe it wasn't a severe brain injury. If you have symptoms 2 years later, that's pretty significant to me. So the mild, moderate, and severe really talk about kind of the mechanism of injury, but they don't talk about the severity of the injury. And we shouldn't grade concussions. I never tell the parent your son has a mild concussion, because I don't know until he's all better. When he's all better, then I can tell him that. And so I think that's the first point. The second point, and you brought it up, research is emerging. We've had animal data research, and now we have some human data research. And this is the first time I've ever seen anything about school. I saw it last week. Our animal data shows that if you get a concussion, you exercise the animal right away, they don't do very well. And if they rest and then they exercise later, and the exercise is voluntary, they do the best. And the third one was they didn't exercise at all ever, and they were a slug. And so they kind of did in the middle. So now we have some human data that says right after an injury, the best thing you can do is rest. You can get those extra hours of sleep. Don't get up early and try to go to school. Just rest. If you start feeling better, then you add in some cognitive piece. So they do a little bit of schoolwork, and I like them to do it at home. If that goes well, then we add more, and we add more. And if we allow people to self-pace, they usually do pretty well. The problem with kids is that they usually follow adults. If the adult says, here's a test, it's an hour long, please take it. They don't 20 minutes in the test say, my head's really hurting, I'm going to stop now. They just keep doing it. So that's really harmful for them. So a lot of times it's easier not give them the opportunity to keep going. So you say, do it at home, self-pace, and we'll ramp up gradually. Later on, and certainly in post-concussion syndrome, we find that exercise is good for people. It actually promotes brain healing. There's some proteins that are released from your brain when you exercise. That's good. So for the people who can exercise, it's a problem. But if I could get them exercising, I think it helps people feel better. And we use it all the time for our long-term rehab concussions. So I think there's two parts to that. The first part is early rest is very important. And then gradual resuming activity is the treatment. And so if you do those things, so my little guy who was 9 who got the concussion on Thursday didn't go to school Friday, didn't go to school Saturday or Sunday, and came and saw me today, and now he's feeling a whole lot better. He slept about 14 hours each day, so unrestricted. His parents kept an eye on him. He's 9, so he's still running around a little bit, but he didn't know any organized sports, and he didn't hit his head anymore. So now we'll have him go to school, so he's actually going to school tomorrow, and we'll kind of ramp him up. And when he's in school all day, then I'm going to add some physical activity in. If he does well with that, then we'll start talking about return back to play. So really, recovery from concussion is a process. It's not a yes or no. And as Keith said, oh, we got a concussion, you're out for 7 days and you're back in. Well, he's supposed to go through a process. And if he's healed on day 6, then maybe he's healed. And if he's healed on day 10, then he's healed on day 10. And so we don't want to say it's a timeline. It's really a process. When you complete the process, you're good to go. I hope that answers your questions.
Doc, let me just thank you for being one of the few doctors that doesn't use the term mild. Let me ask you guys a question. How many of you have had mild diarrhea? How many of you have heard the term, no, you have diarrhea or you don't? How many of you have been mildly pregnant? No, you're pregnant or not. Someone asked Sidney Crosby how his mild concussion was that took him out for 18 months. The 2 girls sitting next to me, the gentleman sitting over my right shoulder, Keith, will all tell you that anxiety is the worst thing for us in trying to heal and feel better. Very few doctors still do what Doc does. Mild, moderate, severe has to get out of our language, because immediately when the athlete or the child hears mild and they're not better in 2 to 3 weeks, they're panicking. When they hear severe, they think, oh my goodness, I'm going to be like Taylor Twellman or Keith Primeau and I'm never going to play again. You have a concussion, the doctor, the parents, the coaches, you have a concussion. When you feel better, we'll start talking about it. And I say it as a joke, but really think about it. Either you're pregnant or you're not. So you have a concussion, you have a concussion. The severity, I think, Doc, comes with how you recover. And that's when you can determine whether or not, oh yeah, I recovered in a week, I have mild concussion. But to do it right at the beginning, how do we know? Sidney Crosby was told mild concussion was out 18.5 months.
And if I could follow up on the Sidney Crosby comment, I think people don't recognize it. He actually had a concussion a couple days before the second concussion. So he had a concussion on January 1st, felt better 4 days later and played again, and then got hit again. And so that's what I've been talking about, that you get an injury, you're almost better, you start to feel better, and you get re-injured, and you're not really healed, and those end up being a disaster. And then 18 months later, you're better.
A learning specialist at George School, a parent, EPY, I say coach in the past, so I see it from a lot of different directions. Dr. Grady, I was at the CHOP workshop a couple weeks ago.
For the educators.
Yes.
Our first annual educator conference, by the way, because we're working on it.
Outstanding information.
We're getting there.
Yes, great stuff. So this is awesome, and coaches and parents, it's great. I think the piece that has to come together is communication with the school as well. You know, you said it well, Coach, that it has to go back and forth, and this is such a fluid thing. We're a boarding school, and I have a freshman who's had 2 concussions this year, and her parents are in Italy. And so where does she go? We have to develop this. What do we do for this downtime, for this cognitive rest and setting back? And we're having the same discussions with our faculty about this means she's not doing any work. We're not letting her, it doesn't mean work until you think you're tired or work until you think you have a limit, but we have to cut it off and set the time. I have to set a schedule for her during the day of saying, okay, you're going to go to these 2 classes, and then you're going to go and rest, and then you're going to go to another class, and you're going to have lunch, but not a long time because it's noisy in the dining hall, and then you're going to go to another class and rest. So, but that's, an adult has to do that for her and not have the student try to figure that out along the way. And it's really stepping up and being the unpopular person with teachers who are saying, well, look at it, she's fine on Saturday and having fun with friends, but that's part of the whole thing, isn't it? It's that we're figuring it out. So I appreciate what you're saying here, and I think it's really that communication and, you know, with the school coaches, with the school teachers and everything else, it's got to, you know, come around and around. So thank you, everybody.
Parent for a U11 soccer player in Upper Moreland. I'd like to know how best to handle the concussion at the point of concussion. Like, how's the best way? Just to highlight what happened to my son, like a couple months ago. He was playing indoor soccer, and which I'm not a big fan of, but anyway, a whole gang, he was in a corner, and a whole gang of other players barreled him over. He hit his head on the wall, and he couldn't get up. His legs were all wobbly. Nobody in the place knew what to do. So my wife, who's hyper protective, you know, called 911 and had an ambulance take him to Abington Hospital. They said he didn't have a concussion, but they said follow up with his family doctor. So we followed up, and because he was having headaches and he kept sleeping, like way more than he normally does. And then we took him to the family doctor, and the doctor was like, well, we're not going to have a CAT scan or whatever, but we're going to treat it like it was a concussion. And so then for the next week, you know, he took it easy and didn't play soccer for the rest of the indoor league. So anyway, I just would like to know that at the point of concussion, what is the best way to handle it to have the best result?
Leanne. So in your situation, I would say that moms are always right. So if the mom wants to freak out and call 911, go ahead. There's no problem with that. Not in every situation, that's not necessary. If you have an athlete who is sitting there and says, you know what, I have a headache, I don't feel right, you don't necessarily have to call 911. If they're staying stable and not kind of deteriorating in front of you, you don't necessarily have to go the route of calling 911. If you have an athlete who can't get up and they're not able to answer questions and they're really disoriented and nauseous, I mean, call 911. Again, you're not wrong with that, because get them to where they need to be, make sure that they're going to survive until the next morning, and then you've done your job for that part. Anytime that you have anybody with a symptom, automatically sit them out. So SCAT2 has a pocket scat that's available on all of your cell phones. You can download it for free, and if you go through and you check off, yes, they're saying they have this one symptom, sit them out. Sit them out and let a physician who is trained to handle it, like Dr. Grady or any of the other specialists in the area, to evaluate and really determine, is this appropriate? Are we dealing with a concussion at that point? But a lot of times you're looking at someone who says, hey, I'm okay, but maybe their balance is off. And so I'll automatically sit someone if they're still telling me they're fine, but they look a little off. Their personality is not the same. They're kind of falling asleep by themselves. I've had players that will laugh at nothing. They're sitting in a corner by themselves, and they're laughing hysterically about nothing at all. And so more emotional, less emotional, any of that stuff, automatically sit and then seek further evaluation with a specialist to either confirm or rule out the injury in and of itself. And
just to clarify, a concussion is an injury to the brain, and the brain doesn't work right. And it's a shaking injury usually. So the brain doesn't work right may mean you have memory problems, you have balance problems, you have eye tracking problems, probably all of those, emotional problems, and you may have somatic symptoms, headache, nausea, vomiting, dizziness, all those things. So when you're saying someone got hit in the head or their head really shook hard, whether it's actually a blow to the chest or a blow to the head, whiplash can do it as well, and they have those symptoms, they have a concussion, and an MRI and a CT scan does not pick that up. So if you go to the emergency room and you get an MRI or CT, and they say it's normal, that doesn't say you don't have a concussion. It says you don't have a skull fracture, you don't have a head bleed. And then you can initiate treatment without any pictures. You don't need the pictures to make the treatment. The treatment is a clinical diagnosis, and what you really need is the person who's making that evaluation to say, are you functioning normally? And if you're the parent and you say, this is not my child, they can't do things they normally can do, then you're probably enough of a clinician to say, they're not normal, their brain's not working normal, therefore it's a concussion. And then I need to get them rest and find someone who can evaluate this medically. So back to the scenario of you're on the field, the little kid gets kicked in the head because he's scrambling for a ball, or there's a collision and someone goes down. First, you make sure their neck isn't broken. And so if you think you have a broken neck, that's a whole different story. And you leave them right where they are and you call 911. If their neck's not broken, but they clearly have symptoms that are not working right, then they're out of the game, and then you see an appropriate medical professional. And only if you have those really, if you think that they could have more than just a concussion, so if you think that they could have a bleed inside their head or a skull fracture, so if they hit their head on a metal pipe, that's a whole different story. Then maybe you need to go to the emergency room for a CAT scan to look for that. But that's different. And so if you have someone who's slurring their speech, who's throwing up, who's incoherent, okay, yeah, they need to go to the emergency room now. If they have headache and nauseous, they're a little dizzy, and they were wearing a football helmet and they got head-to-head collision, they have a concussion, then you just keep an eye on them. And they just need the rest, quite honestly. So I think as a parent, you're the first line of defense. You recognize something's not right with my kid. Okay, their brain's not working right, that's a concussion.
Kim and Casey, what's the most important thing you learned tonight, Kim?
That we aren't alone. There's a lot of support. There's things going on. We're going to get better.
Casey.
Yeah, like, we're not alone. Things will get better, and that we have support, and just to get awareness out there for people who have concussions and that they're not alone.